so much, Julie. And thank you for having me at this wonderful, wonderful event. We need to give a round of applause to Julie Thompson-Dopkin and everybody associated with such a wonderful project and such a wonderful exhibit here today. And I'm truly honored to be here with colleagues, friends, patients, families, caregivers, and everybody else whose lives have intersected with epilepsy and seizures in some way. I'm also humbled to be here amid this amazing art, the product of creative minds and hands, whose vision and whose craft are just so inspiring and are moving all of us. So thank you for this opportunity, and thank you for this honor. Now, you might know that the word doctor comes from the Latin word docere, which means to teach. So doctors are teachers. Medicine and education are actually inseparable. They're intertwined. And this is of course true in the doctor-patient relationship. So doctors teach their patients every day about the science behind their disorder, about the up-to-date research on treatment or cure, or sometimes even just prevention of their condition. But doctors also learn from their patients, because patients also teach and learn. And patients teach their doctors about what it's like to live with the condition, and how the condition can affect different parts of their life, but not come to define or dominate their life. And that's been for centuries, this teaching and learning that happens in the doctor-patient relationship. But in recent years, increasingly, there's additional ways in which doctors and patients learn from each other. So in recent years, patients sometimes teach us about nutrition, about exercise, about other health-maintaining lifestyle activities that kind of get short shrift in the medical school curriculum. And in recent years, increasingly, doctors teach patients based on our understanding of human psychology, about the importance of mindset, and how sometimes mindset and behaviors can affect, in one way or the other, patients' experience with their disorders, sometimes doing good, sometimes doing harm. And so, as we go forward as patients and as healthcare providers, I think there's teaching and learning to be had all around in both directions. Now, as Julie mentioned, 2 months ago I took on the position as Dean for Medical Education at Harvard Medical School, and in this position I oversee the education of the medical students who are going to be getting their MD degrees. And one of the reasons I took on this position is that I think it offers us the opportunity to really change how we educate the next generation of doctors. These are future physicians. And these students, sometimes I still call them kids, these medical students in their careers are going to end up seeing so many more patients than I ever will be able to. And so in some little way, I'm hoping to be able to influence how we train them and how we educate them to be the best possible doctors and have that much of a greater impact in the future. I'm going to ask a question. So how many of you who are here, either as a patient or a family member, a friend, a loved one, a caretaker, how many of you here have been in an appointment in a healthcare setting in which you felt that the healthcare provider just didn't understand what it was like to live with epilepsy? So quite a number, right? So that's our challenge. Our challenge is to help train this next generation of doctors to understand the patient's perspective and the lived experience with epilepsy, but also with other disorders, right? Other disorders that lead to hidden disability. And how might we be able to do that? Well, I'll give you one example. So at Harvard Medical School, the way we used to teach about epilepsy and seizures was through books, right? And manuals, and anatomical atlases, and of course that's very important. You wouldn't want your doctor not to know the science behind epilepsy, right? But we've changed things, and we've taken 2 big steps. The first step, a few years ago, was that I brought one of my patients, and I'm realizing now, I didn't ask him permission in advance, so I'm not going to say his name here, but I asked one of my patients to come in to the AV studio at Harvard Medical School, and we recorded my interviewing him and his telling his story about his life with epilepsy and then ultimately having epilepsy surgery. And now when we teach about epilepsy to our medical students, they begin by watching those videos. So they do learn the science and the anatomy and the physiology, but they start by hearing my patient tell his story. Now, what happened during the pandemic? Well, during the pandemic, we were very separated. And, we had a hard time bringing in patients to be interviewed, right? And so what did we do? Well, we took advantage of what we all did using Zoom and video conferencing, and we would have the students Zoom in to the patients in their home environment. And that was even something additional, because now not only were you hearing the patient tell their story, you were seeing them in their living room, in their bedroom. You were seeing their family members. You were seeing their environment, their pets. And so that's yet another additional phase of how we're exposing our students to the lived experience that our patients go through every single day. Now, I also want to highlight something which is true in medicine, which is that in most circumstances, we know from research that patients do better when they are taken care of by doctors who look like them. And that means doctors who are of the same racial and ethnic background, or it means doctors who have a similar national origin, or it means doctors who have a similar socioeconomic background, or a similar family structure. And so one of our goals is to train and graduate generations of doctors who properly represent the diversity of patients that we see with epilepsy and with other disorders. Because that's how we're going to best help everybody in the community, all of our patients, is by making sure that our students, our future doctors, also come from all of those backgrounds and all those experiences and all those families, just like our patients do. So that's another mission of mine in the coming years. Thank you so much for coming. Thank you for being among the art. If there's something that you appreciate and you're able, please buy it and take it home. I'm going to be buying a couple of pieces for myself. And thank you, Julie, again, for this honor and for gathering us all today.
For all the work you do, we'd like to present you with Stop Clowning Around. And this is an artist out of New Hampshire. And this has quite a bit of significance, and I'll let you read the story, but I created her story on this for you. And you can send it home with Greg or somebody, you can drop it off. But that's for you, and this is just a little card, so thank you. So this is for your office and in remembrance of this evening. So thank you so much.
Really thank you so much. I know exactly where this is going to go. Which is on the wall behind me, so that when I am on Zoom conferences, this is what people are saying.